Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful, and it's led by Dr. Shilpi Sachdev from Apollo Cradle and Children's Hospital. She is going to talk about ovarian cancer symptoms and causes. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Good afternoon, everyone. I'm Dr. Shilpi Sachdev, consultant, obstetrician, and gynecologist at Apollo Cradle, Motinagar. So, today the topic of my discussion, as already told, is ovarian cancer, symptoms, and causes. Now, the ovarian cancer is the cancer which arises from the cells of the ovaries, which is an organ in female reproductive tract which forms the eggs. Now, this cancer is though rare, but the incidence is 1 million in Indian female population. But the problem of this cancer is that diagnosis of this cancer occurs late, and the symptoms are also very non-specific. Non-specific means it is not the thing. These are very general symptoms which can be felt by any female for normal day routine activities and daytime. So that is why I'm going to discuss with you. And the symptoms in early stages are not there, and in late stages there are symptoms which are non-specific, as the female may feel some bowel rolling movement in the abdomen, some gaseous distension, or she may feel heaviness in abdomen. She may not feel like eating anything, or there would be nausea. So the female may have changed in her bowel habits, like sometimes she has constipation and sometimes she has loose motions. Also, because of loss of appetite or nausea, the weight reduces. So there is loss of weight also. Also, if she is postmenopausal, or she has stopped with her periods, she might have postmenopausal bleeding, or there may be some abnormal vaginal discharge, so which is not usual for her. So these symptoms are normal gastric symptoms, gastrointestinal symptoms, and very general non-specific symptoms. So, anytime if a female is feeling these problems, she should go and show herself to a gynecologist or a physician. And the certain investigations and examination needs to be done. Now, I would like to discuss certain high risk factors which are more predisposed to ovarian cancer, and these females should be more careful. So, as you age beyond 50 years, the chances of ovarian cancer increases. Also, if there is some history of infertility treatment or undergoing IVF, then you are more prone for ovarian cancer. So you should be more cautious. If there is a family history of ovarian cancer, breast cancer, or colon cancer, that is intestinal cancer, then also you should be more vigilant of these symptoms and you should meet your doctor. Then there are other things, like if the female has started her periods early in life, that is early menarche, less than 12 years of age, or she had late menopause. So that also predisposes her to ovarian cancer. If the female has taken hormone replacement therapy or estrogen replacement therapy, then also she is more predisposed. If there is some genetic testing done in the family, or genetic testing for that particular female, and she is BRCA gene 1 and 2 positive, then also she is high risk for ovarian cancer. Now, there are certain factors which reduces your chances of having ovarian cancer, like late menarche, or the periods have started late, or there is early menopause. Also, if the female has taken oral contraceptive pills for a prolonged period of time, so generally it is said that if you take OCPs for 10 continuous years, then the chance of ovarian, uterine, and cervical cancer reduces by 50%. So they are protective. Also, if the female has got her tubes removed for any reason, that also reduces her chances of having ovarian cancer. Also, if you are getting your self checked and you don't have any family history, or if you don't have any genes related positive, then also chances are less. The females who have born children and more number of children, they are less predisposed, and the females who never had children, are nulliparous, are more predisposed to having ovarian cancer. Now, how to diagnose this? So once you visit your doctor will examine you. She will do a abdominal examination and pelvic examination, and she would tell you that yes, you have a looks like, it is not confirmatory, but yes, she can give you clue that looks like cancer thing, and then the things are confirmed on investigations, like you get imaging tests done, so starting with ultrasound and CT scan, so that detects the staging of the disease and the malignancy also. Then there are certain blood tests like CA-125, which if increased, so that also is a marker, but it is not a confirmed marker for ovarian cancer only. It is raised in other conditions also. So if CA-125 is raised, so don't be panicky. But yes, this is a protein which is released from surface of ovarian cells, so it is a marker of general ovarian disease. So this is the way that the things are diagnosed, and the treatment is little easy if it is detected early, and the treatment becomes difficult if it is detected late. So the treatment modalities are the surgery, chemotherapy, radiotherapy. Thank you. If there are any questions, you can ask. Okay, thank you everyone. Can't see any questions. So we'll call it a day. Thank you.